I am Deogratias Katabalo, and I am excited to present our scoping review on the pharmacogenomics of chemotherapies for childhood cancers in Africa. This work presents a critical but underexplored area of research on how genetic variations influence chemotherapy outcomes in African children. Africa is a continent with a remarkable genetic diversity and a high burden of childhood cancers. These unique factors present both challenges and opportunities for advancing cancer treatment. A real-life clinical observation sparked our interest in this research. In our day-to-day activities, we encountered several patients who would suffer severe adverse drug reaction from the use of chemotherapies. One of particular importance was the patient who suffered severe myelosuppression from the treatment of acute lymphoblastic leukemia using 6-mercaptopurine and methotrexate at a standard dose, necessitating the healthcare team to put him on the dose lower than the standard dose. This life-threatening complication raised critical questions about the role of genetic variation in chemotherapy outcome and inspired us to delve deeper into pharmacogenomics research in Africa. Having this question in mind, we composed and registered a study protocol on the Open Science Framework, upon which we conducted a comprehensive set of studies published in Africa in selected academic literature database up to September 2024. We included laboratory genetic analysis studies as well as survey studies assessing healthcare workers' knowledge, attitude, and perceptions on pharmacogenomics. By mapping the existing literature, we aimed to identify key genetic variants, their linked chemotherapies, and the knowledge of healthcare workers on pharmacogenomics in Africa. While we searched for studies published across the entire African continent, we included studies originated from 6 specific countries, and these are Kenya, Egypt, Zimbabwe, Nigeria, Tunisia, and Libya. We identified 12 key genes across 8 studies, including TPMT, CYP3A5, MDR1, MAPT, ITPA, IMPDH1, ACLC29A1, A2, A3, ABCC4, and MTHFR. Among these mostly commonly repeated genes, variants TPMT3A and 3C were the most reported, and of interest, 3C were predominant in Africans' black race origin, and the 3A were predominant in African of Arab race origin. The gene CYP3A4 was reported across all African races, with predominating variants being STAR3 and STAR6. Moreover, about 4 chemotherapies were implicated in pharmacogenomic studies in Africa, and these are 6-mercaptopurine, vincristine, methotrexate, and cyclophosphamide, all of which are commonly used in the treatment of childhood cancers. Our study further revealed that the knowledge of pharmacogenomics among healthcare workers in Africa remains low, even though the attitude toward the clinical application are positive. In conclusion, our review sheds light on the impact of genetic variation on chemotherapy outcome in African children with cancer. However, research remains regionally limited, leaving significant gap in knowledge and application. Expanding pharmacogenomic studies and building local capacity are essential for advancing personalized medicine in Africa. This is a call to action for researchers, clinicians, and policymakers to invest in this vital field of study. Thank you for your time and interest in our work. To learn more, please feel free to reach out. Together, we can pave the way for better treatment for children with cancer in Africa.